So I told you that, hello dear students, so I told you in the previous class that whenever you found a condition like this, supraventricular tachycardia, supraventricular means atrial, supraventricular tachycardia with the AV nodal block, then it automatically comes in the mind that it may be the digitalis toxicity until it is proven. So let me tell you the ECG pattern. You know, normally the ECG pattern goes like this. You know, this is the atrial depolarization. This is known as P wave. It is caused by the SA node. Okay. Then after SA node generated the depolarization, then the conduction occurs from SA node to the AV node. And there occur a dip. This dip is known as AV delay up to the Q. Okay. This AV delay, after the AV delay, systolic contraction begins. Systolic contraction QRS. This is your systolic contraction, and after systolic contraction there occurs a plateau phase. This is the plateau phase of the calcium plateau phase. Then after that a T wave occurs, that is the relaxation phase. This is the T wave. You know, I told you that this is your zero phase, then a little dip because of potassium, and the plateau phase because of calcium, and then relaxation. This is the P wave generated by the SA node. This is the segment. This segment is known as P, if you include R in this, PR segment. This is PR interval, PR interval. This is ST segment, ST segment, ST segment. Now, see, when a patient is under digitalis, that is, he is digitalized. Okay, the patient is having digitalis toxicity, and what you get from the ECG by looking on ECG. Look, the patient, because of the ectopic foci, it going to generate the P wave. Okay, the P wave is there by the ectopic foci, not by the pacemaker. Say for example, by the ectopic foci. So atrial depolarization, atrial will contract there. That P wave is there. If P wave is there, you know, what I told you, P wave is there, that is contraction is there, but there is delay. There is delay in the conduction of impulse from AV node to the ventricles. So that means the conduction goes on. There is delay. At one time, say for example, if it is a first degree block or 2 degree block, if it is first or 2 degree block, then they send the signal. Then they send the signal to the ventricle to start contraction. Now P wave is there, QR, you know, look what is happening to the PR interval. So what is happening to the PR interval? It increases the PR interval. Digitalized patient is having increased PR interval. Okay. Now coming to the contraction now. Now the stimulus reaches the ventricle, and you know that digitalis is positive inotropic. It is having loads of calcium inside it. So it is positive inotropic. At the same time it is positive clinotropic, that is velocity is also increased. That means this contraction comes very quickly. Very quickly it comes. If contraction comes very quickly, that means the relaxed plateau phase is very small, and the relaxation will come quickly. Relaxation will also come quickly. That means relaxation will also come quickly. Okay. So this is T wave. So see, what is happening to the PR interval increases. What is happening to the ST segment? It decreases. So this is the typical example, typical ECG pattern of digitalis toxicity. Digitalis toxicity. This is the ECG pattern. This is your normal. You know, there is condition. And what is the difference between another calcium loaded, say for example, ischemic heart disease? What is going to happen? There is also the calcium loading, but in ischemic heart disease, there is no this blockage of the SA node or AV node. That means P wave is also there. P wave is there, normal P wave, normal QR interval, PR interval, because AV node is not blocked in ischemic condition. Okay, so normal dip is there, normal, but what happened to the contraction? The contraction is clinotropic because of calcium loader. He is calcium loader. It is calcium loader. That means both both inotropic and both clinotropy is there. That means your ST segment is very quick. But then where is the difference? The difference is PR interval is normal. PR interval is normal. ST interval is quick, just like digitalized toxicity. But where is the difference? You know, in ischemic disease, the main difference lies here at the T wave. There occurs reversible T wave in case of ischemic heart disease. So now you can see the pattern on the ECG, and you can see, okay, oh, this is normal heart. Oh, this PRL interval increases. Okay. You know, there are other conditions in which the PR interval, when PR interval is going to increase? When there is nodal block. And which drug is going to block the nodal cell? Number one is your digitalis. Digitalis blocks, increases this. There is calcium blockers. Calcium blockers going to increase this. Beta blockers also going to, sympathetic antagonists, okay, going to block this. So these are the conditions you are seeing at the ECG pattern. Okay, that we stop the topic here. Thank you.